American Heart Association, in 2006, nearly 10 million children between the ages of 6 and 19 were considered obese. This number has tripled since 1980. This increase is due largely to the poor eating habits and the inactivity of school-aged children. Schools have begun to address the improvement of nutritional content of their lunch menus, however have ignored the importance of the mandatory physical education needed in schools daily. Today I will discuss the negative effects of childhood obesity, the lack of mandatory physical education in our schools, and the changes needed to address this epidemic. Obesity affects not only a child's physical but mental health. According to the Center for Disease Control and Prevention, obesity is a major health risk factor linked to cardiovascular disease, certain types of cancer, type 2 diabetes, and early death. In addition, the American Heart Association reports that physical activity has a positive effect on cognitive ability, while reducing tobacco use, insomnia, depression, and anxiety. It should be clear that physical education should be mandatory to prevent the negative physical and mental effects associated with obesity. National guidelines recommend a weekly minimum of physical activity to be 150 minutes for elementary age children and 225 minutes for middle and high school age children. Individual states are responsible for setting these guidelines for schools to follow for mandatory physical education. Unfortunately, of the 50 states, only one, Illinois, has a daily mandatory physical education requirement. It is clear that state governments have not taken the initiative that needed to set physical education guidelines consistent with the recommendations set by the federal government. In order to ensure that children are receiving at least the minimum amount of physical education recommended by national guidelines, schools must be mandated to enforce mandatory physical education for daily use. In the past, the reasoning for legislators to focusing on the lack of physical education or the reduction of physical education in schools is for budgetary concerns. However, according to the National Association for Children's Hospital and Related Institutions, the annual obesity-related hospital costs for children has more than tripled over the past 2 decades. It is clear that any money that would be saved from the cutting of physical education programs in schools has only shifted to medical costs for these same children. Physical education in schools is the only way to ensure that children remain active, which serves as the foundation for a healthy lifestyle. Considering the fact that childhood obesity, if not taken into account today, can lead to an early onset death, we are obligated to change the school systems to include mandatory physical education as part of their curriculum. Because children are our future, we need to ensure that they live long enough to have one.